briefing about COVID-19 in London and Middlesex County. As always, we're joined by London Mayor Ed Holder and the Medical Officer of Health and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. We welcome the media who are in attendance and remind them to submit their questions in the question and answer forum that is part of the Microsoft Teams platform we're using today, identifying themselves and their media outlet. We also welcome those tuning in on Rogers Television, the Rogers YouTube channel, and their Facebook page, as well as those tuning in on Global News Radio AM 980 CFPL, and people who are watching on the CTV London website. We welcome you all today. Let's start with our opening statements. First.
Well, thanks very much, Dan, and good afternoon, everyone. So today is International Nurses Day, and in recognition of our frontline healthcare workers, I'm very, very proud to wear this shirt. It's part of their Hearts and Smiles campaign, and you can get your own at heartsandsmiles.ca along with a mask. Proceeds from these shirts and masks go to the Frontline Fund, which supports 150 hospital foundations across Canada. These foundations provide supplies and support for healthcare professionals who put themselves ahead of others to ensure our safety and well-being. So to the nurses who work every day on the front lines, providing care, comfort, and kindness in those loneliest of moments, we honor you, we celebrate you, and we thank you. And just a few minutes ago at 2 o'clock, the London Economic Development Corporation opened its first ever virtual job fair. We talked about this before briefly, but it's important that for those who are looking for a job, or if you know someone who's looking for a position, I encourage you to visit their website. The address is londonareaworks.vfairs.com. That's V like Victor. Again, that's londonareaworks.vfairs.com. If you're a job seeker, it's free to participate, and nearly 1,000 jobs are currently available. And it runs until 6 o'clock tonight. So typically in years past, this event takes place at Western Fair Agriplex, drawing thousands of attendees. I'd like to compliment and applaud the LEDC and employers for adjusting so quickly to host this important event virtually. Beyond today's jobs fair, you can also browse the largest jobs board in the region, londonjobsnow.ca. As of today, despite the pandemic, there are more than 3,000 jobs listed on londonjobsnow.ca. So together, let's keep London working. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor, and thank you especially for recognizing International Nurses Day, Florence Nightingale's birthday. It's something that our nursing staff at the Health Unit always appreciate. Normally we gather on this day and celebrate nurses and share food and warm beverages, but of course not this year. To the numbers, we had just 2 cases reported in Middlesex and London yesterday. Unfortunately, there were also 2 deaths reported, a male in his 80s and a female in her 60s. Provincially, slight increase in the numbers of cases reported today, 360, but that 5-day moving average is still declining. Generally reassuring trends. You did see a slight shift in the messaging from the province in the last 24 hours around masks. At this point, provincially, masks are being viewed as part of a recovery strategy. This would be non-medical masks worn by non-medical personnel. And the idea being that there may be some benefit, not to the wearer of the mask, but to other people around them, related to any coughs or sneezes that would be kind of trapped in the mask and not able to infect other people. We certainly welcome this message. It's also very important to remember the limitations of masks. If they're not worn properly and or they cause the person to touch their face more often to adjust the mask or to itch, then they actually might introduce more microbes into the person's face than less. They also won't completely protect the wearer. And in fact, non-medical masks, even medical masks, offer only limited protection to the person who's wearing that mask. And so it's very important to try and maintain at least 6 feet apart even when wearing masks in places where you consider them necessary. That's it for me, Dan. We'll pause for questions.
Thank you very much, Dr. Mackie, and thank you, Mayor Holder. And yes, absolutely a recognition of the nurses on this International Day of the Nurse in the middle of National Nursing Week. So thank you to all of the nurses out there for all that you do. All right, on to the questions. Dr. Mackie, the first one is for you. It comes from Dan Brown at the London Free Press. Pre-COVID, the province was planning to change public health governance, including reducing the number of health units to 10 larger entities. Do you feel the modernization plan will need to be reevaluated because of the pandemic?
Well, I mean, you've already heard some comments from the Premier that health unit governance will be examined after the pandemic. I think it's only appropriate to look at what's happened and figure out what is the ideal situation. I know that we have a great governance structure, a great board here in Middlesex and London, city, county, and province, all represented on that board. They work well together, and it's a real asset to the organization.
All right. The next question, Dr. Mackie, is also for you, and it's a follow-up from Dan Brown. The London Free Press has received a tip there was a COVID-19 case in a person who worked at a construction site. The first question is, can you confirm that? And afterwards, what are workplaces, including construction sites, being asked to do if an employee tests positive for the virus?
So first of all, I don't have information about a construction worker testing positive, but we can tell you the approach to how we handle those sort of situations in a workplace. It's really about the close contacts. Who are the people, if any, that had prolonged face-to-face contact with the individual who's tested positive? There may very well be workplaces where that is nobody. It might be, in lots of workplaces, it might be 1 or 2 people. And then there were potentially a whole bunch of other people that had minimal contact, which really wouldn't put the person at significant risk of acquiring COVID. So how we work with the employer, or even if we work with the employer, really depends on the specifics of the situation. It's possible that we would not have to work with the employer at all if there were no close contacts at that organization. As an example, you'll recall the case of an individual who worked in the bakery in London, and that person had 1 close contact in their rather large workplace. The rest of the employees in that workplace were not at risk.
Okay, so it's about the cases who happen to be in close proximity with that individual who is diagnosed. That's where the contact management piece comes in. Okay. Mr. Mayor, the next question is for you. It comes from Dan Brown at the Free Press. It's not taking away from anyone's pain or loss to say some positive things have emerged from the pandemic. There's been an amazing outpouring of support. What do you think the pandemic has revealed about Londoners? What kind of people are we?
Well, Dan, my Cape Breton mother would say that there's 2 kinds of people in the world. There's givers and takers, and if you surround yourself with the givers, you're going to be okay. What I have certainly discovered over this last many weeks is the capacity for Londoners to give. They give of time, of talent, of treasure, and they give according to the way they're best able. I've seen the way that our social groups in our Mayor's task force, in terms of impact and recovery, have helped each other. How the food bank has said to all the frontline agencies, we'll do the lunches, we'll take care of the costs. You just tell us what you need and we'll get that to you for distribution. I've seen where Cargill came through in London and said we will provide significant funding for that purpose. I've seen in the Economic Impact and Recovery Task Force how when organizations and businesses are looking for space to inventory their product, which has been somewhat difficult, particularly around PPE. Large employers have made themselves available. I've seen how General Dynamics Land Systems and Western Fair have come together to put the plexi masks together for people. I've just seen time and again how, for the greater good, Londoners have come together. I'm not surprised. I'm just honored to be a part of this community where what I see is the gift of giving, and it's done from the heart. And for all of that, for Londoners, as you are able through your time, your talent, your treasure, for what you do, I say heartfelt thanks. I've never been more proud to be a mayor than I am today of this community, for how it stands tall with the community in need.
And Mr. Mayor, just that follow-up part of Dan's question, what kind of people do you think we are in London?
Well, coming back to what my Cape Breton mom would say, this is a community of givers. We are people who, when there's challenges, they step up. We've seen it in terms of the financial supports of the United Way and the Food Bank and the London Community Foundation, who have put together campaigns asking people if they're able and as they're able to be able to provide financial support, and people have stood up and said we'll do what we can. We see actually even the way that people keep that self-distancing. We're very polite people. Londoners are polite, and at the same time, you know what they do is they give people their space, and when they can, they help. And that's what's impressed me so much. Look, these are tough times. We're going through a new normal as how we adjust to things. And the way that Londoners have stood through this, I think just speaks volumes about the kinds of people that Londoners are.
All right. Thank you very much, Mr. Mayor. The next question, gentlemen, is from Steve Young at CTV in London. I'm going to guess this is directed to Dr. Mackie, but Mayor Holder, if you feel you'd like to add some comments afterwards, by all means. Steve's question is this: should there be a provincial inquiry looking at COVID-19? Do you feel we need to examine how we approached the pandemic? Dr. Mackie, we'll start with you.
Sure thing. So I think that the question of a provincial inquiry is really one that I think would be kind of beyond the public health aspects of this. Our work is on the ground, making sure that everything possible is being done to address the cases that are here. I know there have been loud complaints about various parts of the response. But when you look across North America and around the world at how our community has fared, our province and London Middlesex in particular, I don't think we have anything to be ashamed of. I think actually we have a lot to be proud of. So it's always useful to look back in retrospect and learn the lessons that can be learned from this sort of major crisis. But I think we'll learn that we actually did some things very well.
I'll add to that if I can, Dan, to Steve's question, and that is, I think our Middlesex-London Health Unit has done an exceptional job in how they've handled the issues and how we communicate daily to media and to the public to let them know straight up what's going on. And I think if it's not a lesson to be learned, but it's what we're doing today. We declare. We don't hide behind a desk. We talk about what the realities are. I've said through these press conferences several times how I believe the Premier has stood tall in terms of this gradual return to the new normal. And he talked in terms of 3 phases. And as everyone knows, municipalities take their direction from the province. I can imagine for those who are most frustrated, there may be second guessing and questions, but I will not question the careful approach, because we've always put the health and safety of Londoners and people of Middlesex County first. That's the priority. You do that, how can you be faulted for making that kind of a decision? Caution as appropriate, and I think that provincially as well as in this municipality, we can say that we've done it well so far. Still more work to do, but with respect to an inquiry, that's certainly beyond me at this stage as to whether that is an appropriate consideration, but certainly not for the way I believe the province and the municipality and our health unit have handled the situation.
All right. Thank you very much, gentlemen. All right, Dr. Mackie, the next question comes from Sophia Rodriguez at CBC London. Dr. Mackie, there's a few indigenous communities who have worked in collaboration with health units to set up their own assessment centers. Do you know where our neighboring indigenous communities are getting tested for COVID-19?
Yes, so we have been working with our indigenous partner communities, the communities in and around London and Middlesex. The primary source for testing for people who would prefer to seek testing from an indigenous organization is SOHAC, the Southwestern Ontario Aboriginal Health Access Centre. SOHAC has a broad mandate across the region, and they're available for anyone who is self-identifying as Indigenous to get testing at their London or their Windsor sites. We also have been working with the Oneida Health Centre and the Health Centre on Chippewa of the Thames Nation, and both have indicated they want to develop the capacity to do testing in their health center, and we will be providing swabs when they've got the staffing and protocols in place to do that.
All right. Dr. Mackie, the next question is also for you. It comes from Grant Demi at MyFM in Strathroy. Dr. Mackie, last week you said there were 9 active cases in Middlesex County, seeing an increase in a few municipalities in recent days. What is the number now? And that would be the number of active cases.
Yes. So this is related to the question of recovered cases that we've talked about before. Neither of those measures are actually measures that we generally use in public health, so they're not a cut of the data that we do each day. We can get those if needed. Last week we produced that for a question that had come from Warden Burkott-Jessen. But we don't do the active cases in the county or in the city on a daily basis. The main issue here is that, people may be concerned that, there are 9 or 10 or 20 active cases and that actually affects their risk level, when we know that those cases are doing a fantastic job of isolating themselves in their home. We call them at least twice a day and support anybody that needs support to stay isolated. And so the number of active cases in the community is actually not a good measure of the risk. It's a good measure of the fact that we're catching those infections and making sure that people are isolated.
All right. Dr. Mackie, question has just come in from Dan Brown at the Free Press. Children's Hospital added its first COVID-19 case today. Do you have any additional details about this case?
No, at this point, all I know is that an individual who was under 20, and that's all that we would be reporting publicly. Particularly important to maintain confidentiality when we're dealing with minors.
All right. And Sophia Rodriguez has a question that is related. She's curious if there are any risk factors that can land someone under 18 hospitalized for the virus. We haven't seen too many cases in children in the region, and I'm curious if there are any other symptoms parents should be looking out for.
So it's a great question, and as a parent, of course, I appreciate how other parents are worried about their kids at this point. The reality is children are actually at much lower risk of being seriously impacted by coronavirus. For some reason, unlike influenza, which really strikes the very young as it does the very old, coronavirus has caused very few deaths around the world in anyone under age 10. The death rate is well below 1% in that population. The main risk factors that would cause you to be at increased risk of contracting coronavirus or having a serious outcome in children would be similar to those in adults, but particularly things like immune compromise. So, for example, if a child is on cancer drugs, chemotherapy that suppresses their immune system, then that could really put them at risk of acquiring the virus. Respiratory illnesses, something like cystic fibrosis that can affect the young as well, could put that person at risk of acquiring or having a more significant outcome.
Okay. And Sophia did have a quick follow-up question. Was this the first child to be diagnosed with COVID-19 in the region?
So as far as I know, this was the first child. We know it was the first case that did make to hospital. I believe it's their first person under age 20.
Okay. Well, gentlemen, that completes the questions that we had lined up for today. I want to thank you both for your time, and again, thank you for tuning in as well, and for bringing the questions forward and allowing us to share this information, this important information with you. To all the nurses out there, have a fantastic rest of nursing week and a great rest of the day.
Dan, I need to clarify. I actually just found that information. We've actually had six individuals under age 19 who have tested positive for coronavirus at this point.
Okay, thank you very much. So just to clarify, 6 under the age of, you said 18, who have tested positive. All right, thank you very much for getting that in right under the wire. Thank you. All right, well, we'll see the rest of you tomorrow for our next virtual media briefing on Wednesday. Have a great rest of the day.